Hi, this is Dr. Carolyn Coker Ross, bringing you the Inclusive Minds podcast. This podcast was inspired by the book of which I'm a co-editor, entitled Anti-Blackness and the Stories of Authentic Allies, Lived Experiences in the Fight Against Institutionalized Racism. If you're a psychologist, a social worker, an addiction professional, or a healthcare provider, or anyone who wants to broaden your horizons, then this podcast is for you. The goal of the podcast is to help you understand some of the more complex issues facing our culture today. My guests are experts in their fields, and we'll be talking about a wide array of topics, including cross-cultural issues, the intersection of race and trauma, social justice, and health inequities. They will be sharing both their lived experiences and their expert opinions. The goal is to give you a felt experience and to let you know that you're not alone in being confused by these complex issues. We want to provide nuanced information with context that will enable you to make your own decisions about these important topics. Hi, everybody, and welcome to the Inclusive Minds podcast. Today, I have a very special guest, Paula Edwards Gayfield, who's a friend and a colleague, and she's the Regional Assistant Vice President and Diversity and Inclusion Co-Chair at the Renfrew Center, where she oversees clinical and administrative operations for multiple sites. Yeah, she's definitely a busy woman. Including Renfrew's virtual program, Renfrew at Home. She is the co-author of Black Women with Eating Disorders, Clinical Treatment Considerations, and she's a contributing author to Treating Black Women with Eating Disorders, a Clinician's Guide. With over 20 years of experience treating eating disorders and co-occurring mental health concerns, Paula works extensively with adolescents, adults, and families and presents nationally on topics related to eating disorders, culture, and equity. She is a certified eating disorder specialist and approved consultant through IADEP and currently serves on the boards of the National Eating Disorder Association, Project Blackbird, and the advisory board for the Eating Disorder Recovery Support. Paula is deeply committed to advancing culturally responsive care and amplifying the voices of BIPOC communities. And she also maintains in her tiny bit of time she has left in private practice. Welcome to the show, Paula.
Thank you, Carolyn. Oh, it's my pleasure. I am so honored to be here with you. And thank you for saying a friend, because I think that's what I always think about with you, even though I know I hold you in such high regard and esteem, but then it's like, yep, I know Carolyn. Like, versus when I hear people say Dr. Ross, I'm like, oh, Carolyn,
Yeah.
Exactly. So thank you.
Exactly. Yeah. So you are, as your bio states, ultimately one of the most qualified people to talk about treating Black women with eating disorders. Can you share some of the unique challenges that Black women face when they're trying to access treatment for an eating disorder?
Yeah, I think, interestingly, in my free time, as you stated, I do, if I can say, a BIPOC outpatient support group, and actually just did that preceding this discussion. And that was actually one of the topics of conversation that came up, with really being able to truly be committed to treatment when they can participate in treatment, but even the challenges of getting there. So as you questioned, when I think about some of the unique challenges is, and my caveat is, I don't want to make it like all Black women are, the socioeconomic status that they cannot afford treatment or don't have access to insurance. But I think about the cost of, the impact on family, the cost of, how do I balance a job, or how might I need to balance other responsibilities?
Or time taking off from work.
Absolutely, especially if they don't have that additional support. So, and I think, unfortunately, as providers, we sometimes see that as, oh, you're not motivated for treatment, but my life may not align with what you're asking me to do treatment-wise.
Yeah, you can't expect someone to go bankrupt just to get help.
Agreed.
And we know across the country, Black people are underinsured, and that's only going to get worse now. So They may have insurance, but it may not cover
It
treatment.
may not cover, absolutely, and I think that's or higher deductibles or it's something that I
Transportation
frequently
issues.
see. Yes.
Yeah. So, my next question is, how do you see systemic racism and its effect on the diagnosis and care provided to Black women with eating disorders? How
And
does that impact them?
gosh, in so many different ways. I think in terms of, does the culture of a treat if they're in a treatment facility, let's start there down to like a individual outpatient. But does the culture that's in a treatment facility support diversity? Does it reinforce a sense of safety, connectedness that this is for people of color, for Black women? And
Mhm.
I think that even in an ultimate space that let's say yes, you still have individual people, do they? And so as a system in a eating disorder treatment facility, how do they continue to reinforce training, addressing biases amongst their staff? How are we continuously talking about the needs of Black women as well as other people of color with respect to treatment? But I think systemically, we still have this belief of who gets an eating disorder, who's impacted by it even if you didn't think Black women, it's still just this sense of thin, white, adolescent, higher socioeconomic status, young sort of thing. And that's not the only people who are impacted, as we know. And I also think sometimes when we think the diagnosis of anorexia, it's the smallest like subset of full criteria according to the DSM.
And actually, binge eating disorder is more common than
It is
anorexia and
more
bulimia.
absolutely, it is.
Fine.
But
Yeah.
interesting, Carolyn, I think that if we saw binge eating in Black women, it gets seen as, oh, out of control. Like,
Hmm.
maybe is it really binge eating? Because then if it's resulted in a larger body size, then it's out of control. The focus is on weight loss
Yeah.
versus eating patterns, what's going on, what's underlying
What kind of
somewhere.
trauma do you
What
have?
kind absolutely,
Yeah.
and these missed opportunities to even ask those questions. A client once said to me, even in westernized medicine, just to identify it that way, even when you have Black providers, they've sort of taken on the systemic beliefs of, who gets impacted and maybe not necessarily listening to their Black clients as well.
Yeah, exactly.
Mhm.
What do you think about, because one of the things that you mentioned is really something I see a lot of, which is, Black women with binge eating disorder who are in larger bodies being told, oh, you don't have an eating disorder, you just need to lose weight, and then being sent to weight loss programs, which can exacerbate their eating disorders. Do you
Mhm.
think the current, use of GLP-1s and those types of drugs are making that worse, or have you seen that in your centers?
We've seen it a little bit. I do think it makes it worse in part because it's not a long-term solution. Uh,
Mhm.
kind of like what we say with diets, like they don't necessarily work. I think people who have been on or used GLP-1s, maybe you have to keep using it in order to have the same, effect that you or desired result. But what we've sort of noticed in our treatment facilities to some extent, especially in our non-residential facilities, is
Mhm.
that the impact of a person being able to have the meal, that then has sort of, at in treatment. And so, and
Mhm.
part of that, because they're full, they may feel sick, they can only consume so much before feeling fuller, but
So
also
the whole component of nutrition and how you
absolutely
try to teach a patient how to eat differently, how to
correct.
learn what is a normal portion, and all of those things then will be skewed because their appetite has changed and they
Absolutely.
may be having side effects from the GLP-1s. That's a good point.
Absolutely.
Yeah.
And that's what I think happens. And even though we may try to address how do we address that with maybe some other protocols that we have in place, but right, the behavioral change isn't there, as well as the understanding of why. I think about, I don't know about you, but I think about if I feel sick and nauseous, I don't
Mm.
want to eat either, realistically, because I'm fearful of what that consequence may be.
Yeah.
But then if that's what the drug is doing to help decrease your appetite, and that's one of the side effects, then yeah, it's an uphill battle, I think. And then getting individuals to understand that as well, because just like with eating disorders, there's an outcome, right? There's the benefit to doing any of the behaviors that a person may engage in.
Yeah, exactly. Like restricting. And the
Mhm.
question will be once a person loses weight and they get off, everybody I've talked to has regained most of their weight unless they continue on the GLP-1s, maybe at a lower dose. And I have
Okay.
seen that work like once a
Almost like a
month.
maintenance
Yeah,
sort of.
like once a
Okay.
month instead of every week. And that's what we did with, with Suboxone, the buprenorphine for opiate use disorder. And, the
Mhm.
maintenance dose really worked and reduced mortality and relapses and so on. So it'll remain to be seen, but it is my concern is it's so drastic and the fact that they're not screening for eating disorders.
Not screening, and it doesn't have to come from a doctor either. And
Yeah,
so if
nowadays
you're
it's
thinking
online.
about, I can order, absolutely, a person can order it online, and
Mm,
then you can increase the dosage too. And
yeah,
so I don't know how that gets managed when you're ordering it online. I'm imagining you're having to talk with someone, but it may
yeah,
not be a medical doctor.
yeah. I think even the online places, they're still medical, but most of them will not be trained in eating disorders, that's for sure.
Got it. I know someone who was on the GLP-1 and they got it from, I guess they're medical, but someone who had like
Like a
an
PA or an
aesthetic, they might have been a PA, but like one of those like aesthetics practice where maybe they
yeah,
did, some Botox or some sort of, not
right.
surgery, but some different weight loss things as well as like injections and stuff. But that person was prescribing.
They're probably
Right. I think it may have been a PA.
yeah. Okay, well, let's talk a little bit about stereotypes, about race and body image
Yeah.
that can sometimes prevent Black women from being properly diagnosed or from seeking treatment. Like
Mhm,
there was this kind of accepted understanding that Black women, love to be in a bigger body, love to be thick. And so if you're thick, then you're okay. You're not going to be worried about your size or shape.
mhm.
And I just think that's, treating us as monolithic.
Yes, yes.
What
Yeah,
are,
as you said that, I was thinking one size does not fit all,
yeah,
because it
literally and figuratively.
exactly. Because it does, it takes away the individual's idea of what's attractive, appropriate, acceptable for themselves. And like you said, we're not a monolith. I think that if we are focusing on body image in the traditional sense in which we frequently connect it to eating disorders, then that's how we're missing someone's, I guess, if there are any concerns body image wise, as well as just how they define it and look at it. As we know, body image, I think about the, kind of the definition of it's not only how we see ourselves, but how we think other people see us. And as Black women and other women too, people of color, it may not just be size, shape, and weight. It's the other things that connect back to racism in many ways, cultural standards, beauty standards, that then is it hair? Is it skin color? It could
Yeah.
still be size and shape of hips or even your facial features as well. What sort of creates the standard of beauty for some Black clients?
But I think then in people of color, most other non-Black or indigenous people of color don't really think much about, skin color or what we
Mhm,
call colorism. In most societies, whether it be Latinx or Caribbean, the skin color is a huge determinant of body
mhm,
image concern.
mhm. It
So,
really is. I think because we've identified as cousins, but it was people who we really grew up with, like since I was a child, and they were from Puerto Rico, and they really were family. Like, but they
yeah,
biologically they weren't, but they were family. And so I think about my cousins who were from Puerto Rico, who were very much darker skinned. I think initially that was like my exposure to people who were from Puerto Rico that were of darker skin. And
yeah,
so I knew that they would have considered themselves Latinx, but then to get older and see lighter skinned Puerto Rican individuals who did not necessarily identify as Black, was really a difference for me. And
Yeah.
so to see that someone may have put on whatever documentation that they were white, I'm like, no, you're not. You're like, you're Puerto Rican. And so it was just this awareness along the way developmentally of, like you stated, how colorism could exist because maybe what were the privileges that that lighter skinned individual received versus the darker skinned one.
Yeah, for sure. And, I think one of the things that comes to my mind is just the sense of, that also the issue of hair, whether your hair is straight or curly or kinky or
Mhm.
whatever. And, in my family, my family is all of the rainbow.
Mhm.
One of my brothers looks black, one looks Puerto Rican because he had kind of that wavy straight
Oh,
hair,
uh-huh.
a darker skin and so on. But, each of us had a different feeling about, how we looked and about
Mhm.
the color of our skin, our hair and all of that. Are you seeing that a lot in your clients as well?
Absolutely. I think because we've been conditioned, and again, talk about societal messages, right? Where we people have adopted lighter skin is better. And
Yeah.
so when I've seen it in families, there sometimes is conflict just over that. Like even a sense of you think you're better, even if that person doesn't. Again, when I think about the things that come into the therapy room and what we're addressing as providers, are we talking about family dynamics with respect to
Mhm.
skin color and other body image, size, shape? I know, again, we talk about size, shape, but are we talking about features? Are we talking about, hair?
Like
Are
the
we
size of your
discussing
hips
that?
too versus yeah,
Absolutely.
all of
Yeah.
that.
Because
But,
those
we say race is a social construct. If there wasn't such a thing as systemic racism, this conversation would be different. And how do you think that over time this social construct of race has evolved or changed, if
Mm,
at all? I know
that's a
that's a
great
tough one.
question. There's a That's a great question. I think in some ways, personally, it has not evolved
Yeah.
because it's still there. If we go back to slavery, we're still talking about lighter skin, darker skin, who got to be in the house, who wasn't in the house, sort of thing.
Mm.
But
And
then
it's still in society, I
absolutely.
mean, even though it's a social construct, it's very much believed, and
Yes.
we're seeing that even more
Yes.
nowadays,
Yes.
where
Yeah.
people are talking directly about, white supremacy and all of that kind of
Mhm.
stuff.
And I don't know. I know we all kind of explore what's the impact of social media and things like that. And clearly there are some good aspects of social media and some that are not so great.
Mhm.
There are sometimes I think this conversation, I want to hear, from social media. If it's spreading awareness, I get it that people still have their messages tailored to what, kind of how their viewpoint may be. But I guess maybe I sometimes hope that something will seep in, that what the impact really is on a person that you care about. Carolyn, this isn't necessarily connected, and maybe it is. I don't know if you recall when we did a presentation together a few years ago, and we were talking about your first racialized experience
Yeah.
and
Mhm.
how there was a
That
person in
was
the audience.
Beverly
I will
Beverly
never forget
Tatum's
this.
exercise. What'd you
Yes, but I will never forget the person in the room who talked about her first racialized experience when she had slept over her cousin's house and had wanted to watch like That's So Raven because it was one of her favorite television shows.
Yeah.
And her cousins were like, "Oh, we can't watch colored TV." And she was like, "But you have a color TV, you know?" And how that was like such a like shocking. I
Revelation.
think she said maybe she was like 9 or 10 or something, and that was just so yeah, I don't know. I think that's what I was thinking about when you said, "Have we improved any?"
That's a really good point because when you think about children, when Beverly Tatum did that exercise and has done it, I guess, probably hundreds of times,
Mhm,
she always says that most people have that first racialized experience when they're, between 5 and maybe 9 or so.
mhm.
But before that, just imagine what it's like to be a child who hasn't had that racialized experience.
Yeah,
That's what kind of the promise of what it could be if
yes.
systemic
Yes.
racism what didn't exist
Hmm.
because children are just playing with children. They just love their friends. They just,
Yeah. You're
there's
my friend. Exactly. I just
yeah,
love my friend.
yeah,
Yeah.
exactly. So anyway, I'll stop being so philosophical.
Sorry. Well, that's something that just frequently plays in my mind though. Like that was so powerful for me to hear someone speak and appreciate it. If you're by chance listening, your vulnerability that you displayed like in that presentation.
Yeah, yeah, yeah. What about the role of family and community? Because within our own Black and people of color community, there's
Mhm.
a lot of, bias as well. How does that play into or support, stigmatizing those with eating disorders who are Black women or BIPOC women or men?
Right. Yeah. I think education awareness, we have to incorporate families in this process to help them, one, have an understanding of eating disorders, but also of your loved one's eating disorder and how it presents and what the concerns are. I think, how do we also make sure that our Black clients, I do believe that they are the experts on them. And
Mhm.
so instead of us taking sort of this colonial view of things. And then we're going to talk about independence and that sort of thing. And sure, you can identify some independence, but if they're a part of a system that their system is connected, we need to incorporate that, not sort of, again, what we believe
Yeah,
should be happening with our Black clients. I think also addressing sort of the stigma that still is connected to mental health, but definitely eating disorders. I frequently still hear that people think that, it's a white, again, going back to who gets an eating disorder. So sometimes if a Black person presents with it, then you're just acting white, versus for the life of me, I think about if human beings could be impacted by fill in the blank, why does something have to be, only applicable to a certain group of people?
yeah, yeah. So, what advice do you give to Black women who really feel that misunderstood or unseen by traditional eating disorder treatment programs?
Be willing to ask them questions. I do think that asking questions, sort of like, how do you address race and diversity? How does what my cultural background, the context in what I experience as a Black woman, get incorporated into not just the program, but even my individual sessions, my sessions with the dietitian? I do think that I would encourage Black women and individuals to not avoid discussions of race. I
Yeah,
think my hope is that providers are bringing it up, but even if they don't, you bring it up. I would want you to bring it up, and then I think that's where you get to see if they kind of pull away.
yeah,
Is this the person or the place for me? But not to sort of shrink yourself or tailor your I think we do that so much already, not to tailor who you are
yeah,
and not to bring your whole self into the room because then you're not getting what you need from treatment. I
yeah,
think as providers, we really, really need to think about if I am treating the whole person, race, culture, family, that's the whole person for lots
yeah,
of clients of color. It should be, in my opinion, for everybody, but also thinking about what the racial stressors may be and body politics, food traditions. Again, ideally would want providers to bring that into the room, but as Black clients, throw it out there, see what happens.
do it yourself. Don't
Yeah, yeah,
wait for them to. Do you have
absolutely.
a copy of your book right there with you that you can hold up?
I do.
Yay, let's see it. Okay, so
That is so
Black
cool.
women
Thank you.
with eating disorders, it's hot off the presses, right? Just
Yes.
published. So certainly for clinicians, this is a wonderful resource. Is it something specifically geared towards clinicians or
I
would
think the language sometimes says like your client or your patient, but really we were writing this book for everyone. So
okay,
whether it was a doctor, a dentist, a dietitian, a therapist, a prospective patient, even though I know it's written in the context of a provider, but even that sense of maybe you take it to your provider and say you need to
yeah,
purchase this book, but being able to encourage that person to think about, yes, it's okay for me to bring all of this into the room. And it's up to the provider to be open to that and explore their biases. And dare I say this, I really do believe that opportunities to meet with a client as a provider, I am interviewing them, I'm trying to get a picture of them, I'm getting to know them. But as a patient, I am doing the exact same thing with that provider.
You should be
And
interviewing the provider as well.
exactly. And if it feels at any point along the way that this isn't matching or you're not getting what you need, being open to saying that, being willing to seek, additional resources. And I think that's really important. I think access to care requires us to be seen and heard. I know we say those
You have
things
to be
frequently.
proactive in many cases, so
Absolutely.
yeah.
But I want to feel supported as a Black woman in the process of any therapeutic relationship. And if that support isn't there, acknowledging it. I think that treatment in general it should feel welcoming and affirming. And if it doesn't, then how are we addressing that versus we shouldn't have to
There's
just
something wrong
ignore
with
it.
you because you don't feel
Exactly.
seen. Are
Exactly.
there any other resources or, any organizations that people might be able to access if they're a patient or even if they're a therapist? I think we've given good advice to therapists, but what if you're a patient, a Black woman with an eating disorder,
Yeah.
Latinx, Afro-Caribbean, all of the
Mhm.
variety that we have in our
Mhm.
groups?
Yes. I do think if you're questioning and you're not certain if you have an eating disorder, if this is disorder eating or what it arises to, I think any treatment facility you could contact and say, "Hey, I'm just questioning." Maybe you do an assessment. It's not a commitment. But also, I think organizations like the National Eating Disorder Association, like Project Heal, like the Alliance may have assessments or tools on their websites to even
That's
start to
true.
question
Yeah.
what this is. But I do think some of those places also have resources of providers that identify, if you're looking for a provider of color as well, that might be a place that you can start to. This place does not necessarily treat eating disorder specifically, but the Loveland Foundation, I love them. I know they work to find like
What
therapists
is
of
the name
color.
again?
The Loveland Foundation,
Upland, okay.
and they're usually identifying like Black therapists of color, but there
Mhm.
are also other websites like Therapy for Black Girls and
Yep,
Therapy for Black Men.
yeah,
So there are places that are out there that are like clinicians of color. So absolutely do your research on therapy and people of color or something,
yeah.
that then maybe it'll result with some of these places as well.
Wonderful. Well, it's been great having you on the podcast.
Thank
I
you.
really appreciate all your wisdom and experience, so maybe
Thank you
we'll
so
have to have
much,
you come
Carolyn.
back again.
Thank you. My pleasure. I appreciate you.
Thanks for listening. Please subscribe to the Inclusive Minds podcast so we can let you know when the next great guest comes on. The link to subscribe is in the caption below.